Tonight,
I could go about 100 feet maybe before I had to stop and rest.
I was breathing so heavy, and I says, everything's gray.
an ABC 27 special presentation.
Doctor basically said I had 3 months to live.
Penn State Hershey Heart and Vascular Institute presents Heart to Heart, brought to you by Penn State Milton S. Hershey Medical Center.
Good evening, I'm Chuck Rhodes. February is American Heart Month, and although death rates from heart disease have continued to decline over the past 10 years, coronary heart disease remains the single leading cause of death in America. And in 2010, heart disease cost the United States more than $316 billion, including the cost of health care services, medications, and lost productivity. Now tonight, specialists from Penn State Hershey Heart and Vascular Institute are in the ABC 27 call center to answer your questions about heart and vascular disease. Now, due to a technical problem, our phone lines have changed. Now we have a new number in there for you to call. The new number is 717-236-1444. That's 236-1444. We'll share some of your questions during the show tonight, but keep in mind, all your calls are confidential. Here now, to begin, we have Deborah Pinkerton to share one patient's story with you.
Thanks, Chuck. A Cumberland County man's heart was failing rapidly. Doctors said it was only a matter of time before his heart stopped beating. It was a scary time for Tom Schweitzer. Trains have been a part of 59-year-old Tom Schweitzer's life since he was a baby.
I was born October of 51. I probably had a train set that year for Christmas.
I don't know that he was 2 months old, but I know he was young. His father was a train person, too.
Now Tom is a lover of trains. He shares them with others.
There were about 6 guys that helped build this thing.
For the past several years, he and his friends set up this display in the Mechanicsburg Museum around the Christmas holiday.
It's fun, you know, it's a chance to see trains running. The kids like it, you know. I like it, it's fun.
Last year, Tom couldn't enjoy this fun.
So I was tired all the time. I could go about 100 feet maybe before I had to stop and rest, you know, be like that for about 20 seconds or so, then go another 100 feet.
He was obviously in a bad shape. He couldn't get up the stairs very well. He did, he made it, but he didn't have much energy at all.
Tom's heart was to blame. He had heart problems for nearly 20 years. A defibrillator and medication worked until now.
He had severe congestive heart failure, class 4. We grade heart failure from 1 to 4, and he was essentially end-stage class 4 heart failure. Their mortality, I mean the risk of death over the course of the next 6 months to a year, is extremely high.
The news stopped Tom in his tracks.
My left ventricle was shot. I mean, he said it's done, it's worn out. It can't pump anymore. It was a little depressing. I mean, you know, what can you say? But it is what it is. I mean, it's what, you know, that's what it is, and you're worrying about it isn't going to make it any different. So I try not to worry about it.
But there was reason to worry.
Essentially all medical options for his heart failure treatment have been exhausted, and we were left with assist devices as a potential, not cure for his heart failure, but a potential treatment for his heart failure.
The potential treatment, a left ventricular assist device, also known as the LVAD.
The patient have no other option, either going to die or to get an LVAD.
I'd never heard of it. Oh, I figured, well, may as well try this, see what it does.
In his case, we used what's called a HeartMate 2 ventricular assist device. And essentially what it does is it takes over the function of his left ventricle, the side of his heart that pumps blood to his body, thereby getting rid of his heart failure symptoms.
After a 5-hour operation, Tom was given hope. He spent weeks in the hospital and at rehab centers.
I actually felt better. And then once I got up and actually exercised and did this rehab for about a month and started walking, I said, hey, you know, there's light at the end of the tunnel.
He is doing really well. He is starting to enjoy his life again. He is starting to live again. He is started to be mobile. As you can imagine, before the operation, he was not able to do anything.
Now I come and go when I want, and you just got to be careful about this thing and make sure you take extra batteries and equipment with you. But that's it.
I thank God for the way he is today and for what they're able to do for these people.
Tom's goal is to lose about 30 pounds, so he will be eligible for a heart transplant.
We put the device on him to allow him to lose weight, to allow him to get back to normal, and we're hoping that with the help of the system, he will be able to manage his risk factors to allow us to put him on the waiting list for heart transplantation.
I never figured I'd make it to 70 or 80 years old, but who knows now. My goal is if I get a transplant, I'm going to go back out to Round Top skiing.
And Tom is much closer to reaching his goal. He only needs to lose 20 pounds in order to qualify for a heart transplant. Now, Tom has lived with this LVAD for more than a year, and he says he has not had any problems with it. He sees doctors there at the Med Center on a regular basis to make sure it's working properly. Back to you, Chuck.
Thank you, Deborah. Now joining me in the studio is the doctor that operated on Tom, Dr. Ted Stevenson. Doctor, he seems to be doing well. What's the latest on him?
He's actually doing fantastic. He's lost over 100 pounds of weight so far. He is back to his normal activities. He's spending time with his family and friends, and he's really doing a remarkable job. The ventricular assist device is working perfectly, and he's had no complications from the device at all.
Okay, well, that was an example of using the LVAD device as a destination therapy. How else can that device be used?
Originally, this LVAD was used for a bridge to transplant, meaning having somebody who's really sick supported till their heart transplant. Now we've been using them as destination therapy, meaning that it really is the end of their surgical options. But heart transplantation is still its main indication.
Well, how's that decision made to be given this device or to be put on a transplant list? Is there a protocol there?
Yeah, there's an extensive medical workup, and what happens is that if people are not a candidate for transplantation, they can be considered for a destination device. If they are a candidate for transplantation and their heart is failing too rapidly, we can use this device to get them to a heart transplant.
Now, what's the recovery time? It sounds like that would be something very long.
Actually, recovery time is pretty quick. The hospitalization is around 2 or 3 weeks, and in about 2 or 3 months, people are back to their normal activities and start to feel almost 100% like themselves.
All right, well, thank you for now, Doctor. And let's check in with Deborah back in the call center to see what kind of calls we're getting in there. Deborah?
Right now, Chuck, you're looking at the doctors. They're answering the calls. I'll tell you what, the phone lines have been busy since they opened up at 7 o'clock. Now, here joining us right now is Dr. Dwight Davis, a cardiologist at the Med Center. He's going to answer some viewer questions for us. Thanks for being here.
Happy to be here, Deborah.
This is the first question. What is a silent heart attack, and who is at risk?
Silent heart attack is an event where the heart's damaged, but the patient doesn't realize that he has that damage that's occurring. It occurs quite commonly, and a number of our patients present that way, where we find out later that they've had some damage.
And it can be a very serious heart attack, correct?
It can be either a mild event, and sometimes it can be a very, very significant event that causes the patient to be extremely ill.
Okay, thanks so much for joining us, and we'll come back to you in just a little bit with more viewer questions. Back to you, Chuck.
Thank you, Deborah. And Doctor, now Tom had an LVAD assist device. Are there other types of devices someone could use in that situation?
Yeah, there's a few different devices that are currently in clinical trials and in development, and we at Hershey Medical Center are involved in these trials, and we're using some of these other devices as well.
Now, when a patient has one of these devices, what kind of restrictions do they put on?
We encourage them to get back to their normal activity. The only real restriction that they have is that they can't get wet, like a hot tub or a pool or taking a bath. The reason is that the connection to the drive line, the connection from the pump to the external world, can get infected, and so we encourage people to avoid getting wet as much as possible. But otherwise, they can live their usual life.
Sounds like it's fairly loose at that point. So thank you,
good.
Doctor, for joining us here tonight. Well, you know, shortness of breath, we've all experienced it, but when should we seek medical attention? This Dauphin County man thought it was nothing. He didn't even tell his wife. Deborah Pinkerton will share his story next.